If you can't even outdo it 2 times a day, at least once a day. Some pregnant women can go 1 week without washing themselves. Come on, come on, come on. Hello lovers, welcome to another episode of Very Beautiful Chaos. My name is Debola. How are you doing? I believe you're good. If you're new here, thank you very much for clicking on this video, and please subscribe right away because you're going to love it here. To my older subscribers, thank you for constantly cheering me on. I really appreciate your support. So today's video, we'll be talking about how to glow in pregnancy, how to have a very glowing skin and healthy skin in pregnancy, also how to avoid stretch marks in pregnancy. Oh yeah. Skincare in pregnancy is like a mystery to many, and it is surrounded by a lot of don't, what if, not sure, and a lot of myth. They will tell you don't do this, don't do that, especially in the region where I come from. So you see a lot of pregnant women, they are looking ratchet because they are just scared of using what is going to harm their baby in their womb and all of that, while the people who propel this, don't do it, don't do that, many of them are well-meaning, to be sincere. Many of them are sincere, they have good intentions, but bulk of it comes from the place of little knowledge, lack of understanding. And that lack of understanding, the lack of knowledge, has made them to draw up a lot of unnecessary, what will I call it, a lot of unnecessary regimen for pregnant women. I, for instance, when I was pregnant with my baby, I didn't have any skincare routine for the first 4.5 months. I was just washing myself. I wasn't moisturizing. I wasn't doing anything really till I started gaining knowledge on how to go about it in pregnancy. So today I'm here to talk about skincare in pregnancy. You can glow when you're pregnant and you won't be harming your baby. It is very possible. Yes, I know that there are a lot of products that are harmful to the fetus in your womb, but at the same time, there are lots and lots of products you can use when you're pregnant and you will glow. But before we go ahead, I'd like to put a disclaimer out there, and I wrote it down, so I'll be reading it. This video is not intended to replace medical advice given to you by your doctor. They know your medical history. That is for people with high-risk pregnancy. If your doctor has told you to stay off a certain ingredient, and that ingredients are part of the things I will talk about here as being safe, please and please go with your doctor's advice. Your doctor knows your medical history, and they are the ones that can give you the best advice. Like I said in my first video, I am not a dermatologist. Everything I'll be saying in this video is based on research and personal experience and the experience of other people around me. So if you need more knowledge, or you're confused, you need clarification, do your own research or speak to your gynecologist, speak to your obstetrician. They are the ones that can offer you the best advice. And you see that I mentioned specialists. Don't go and ask one auntie nurse. Don't go and ask one mommy chemist. You people know what I mean already. Go ask specialists. Speak to a dermatologist if you need to. It is okay to moisturize in pregnancy. It is not just okay, it is important you moisturize. It is very, very important you rub your cream. If you don't understand the word moisturize, it is very important to rub cream. It is important. It is important, please, because your whole body is going through a lot of stress in pregnancy, your skin included. Especially your skin is going through a lot of stress. Your skin is going to be expanding. There's a lot of melanin production and all of that, and you won't still moisturize, except the cream you've been using is 7 days whitening lotion or mulatto or whatever. You know what I'm talking about. You're not to be rubbing all those things when you're pregnant, and you should not even be rubbing them on a very good day. On normal days, you shouldn't be rubbing them. But if it's not that just normal moisturizer, please and please don't stop moisturizing your skin. I know that a lot of women love to take care of themselves normally, especially in pregnancy, but the fear of what people have told them, oh, you're going to harm your baby, many of them do not take care of themselves. But there are women who just deliberately choose to ignore their personal care in pregnancy. Please, I'm giving you people the bombastic side eye. Why would you ignore yourself? You know, pregnancy, people make it all about the baby. Everyone around you is concerned about the baby. If you're not careful, even you yourself, you're going to ignore your own care. Please, if you're pregnant, pay attention to your own care too. Your skincare especially, it's the least you can do for yourself when you're pregnant. So let us start with the actives. Number one, I wrote down here, is salicylic acid. It is very safe in pregnancy and recommended by the medical board in US, I think. Yeah, if I'm not wrong, it's 2%. But I would advise that go for 1%. Go for 1%. It is very okay, especially if you have blemish-prone skin, if you have acne-prone skin, or you have oily skin, or you have combination skin. If it has always been in your routine, it is okay to incorporate it into your routine in pregnancy. But 1% is okay, or 0.5% is okay if you're not sure, but it is very okay for you to use. Number two here is lactic acid. Lactic acid is very safe. Even on a regular basis, lactic acid is one of the very gentle exfoliating acids. But you know that even if you're not pregnant, you should not be over exfoliating your skin if it is not necessary. So you can use it 3 times in a week, especially if you're really dealing with hyperpigmentation in pregnancy. Number 3 here is glycolic acid. It is safe. Don't overuse it, of course. Go for the lower concentrations. Number 4 on the list is azelaic acid. It is very safe. I have this. Let me show you. This is from Paula's Choice. To be very honest, my skin does not tolerate anything that contains azelaic acid. My skin does not take it at all. But if your own skin takes it, it is very good for acne, and it is very good for discoloration, for hyperpigmentation caused by acne. I have people that have used it and they told me only good news about it. So you can try it. It is safe in pregnancy. It is very, very safe. So if you're currently dealing with acne, with acne spots, you might really want to try any product containing azelaic acid. For me, my skin does not take it. My skin do not tolerate it at all. In fact, if a product contains just 0.5% of azelaic acid, my skin is going to react. But if your skin tolerates it well before you got pregnant, you can use it. Number 5 here is niacinamide. Niacinamide, everybody knows that it is the good guy in skincare. Though some people have claimed that their skin reacted to it just the way my skin reacts to azelaic acid, and almost everyone only have good things to say about it. So if your skin takes it on a normal day, it is very safe for you to use in pregnancy. And also vitamin C. Vitamin C is okay in pregnancy. If you're using vitamin C serum before you got pregnant, continue using it. Even if you're not using it before, please and please use it now. It's hyaluronic acid. It is safe. In fact, it is important that your skin retains as much moisture as possible in pregnancy. Number 8 here is peptides. Products that contains peptides are very, very important for you in pregnancy to plump your skin, to give your skin that rich anti-gang. Number 9 here is ceramides. Any product containing ceramides, they are very, very safe for you to use in pregnancy. And the most important, sunscreen. Please use sunscreen. Please and please use sunscreen. It is important. You're pregnant or you're not pregnant, use sunscreen. Sunscreen is not going to harm your baby. Sunscreen is not going to do anything to your baby. So please use it. If not, you're going to come out of pregnancy looking like a burnt offering, and you don't like that. You know, a lot of pregnant women come out of pregnancy looking ratchet. You're going to be pitying them. and it's not their fault. It's because of a lot of misinformation about pregnancy. Oh, don't use that. Oh, don't use that. Unnecessary. And please, I'm going to advise that for all these ingredients I mentioned, if you're going to be purchasing anyone, or you want to purchase as many as possible, I strongly advise that you go for brands that have stood the test of time in the skincare industry. Either you want to go for drugstore brands or just skincare brands themselves, whatever it is, please go for brands that have stood the test of time, brands with a reputation of 10 years in skincare, brands with a reputation of 20 years, of 30 years, brands that have a name to protect, not brands that people don't know. I don't want to throw shades here, but I believe people will get the message. Brands that will tell you this is what we put into it, and dermatologists, medical boards can attest to it that truly this is what is inside this product. Don't go and buy, you know it already. Okay, let's talk about exfoliating your skin in pregnancy. Some of the ingredients I mentioned earlier, they are exfoliants like salicylic acid, lactic acid, glycolic acid, azelaic acid. They are all exfoliants which you can use on your face. And there are some of these ingredients that are now in body care products to these days, but I'm not talking about that right now. For physical exfoliants, you know, those ones I talked about earlier are chemical exfoliants. Now let us talk about physical exfoliants, which is scrub. You need to scrub your body in pregnancy. You need to. In fact, when I started skincare in pregnancy, then I think in my 5th month, I was exfoliating at least 3 times a week. Yes, you need to exfoliate your skin. Physical scrub, I mean physical exfoliating. It is your face that it is not advised that you use physical scrubs on, you use physical exfoliants on, but your body needs the physical exfoliant, which is very tricky because many scrubs today contain essential oils, and there is a lot of debate all around, oh, essential oils are not good in pregnancy and all of that. So this physical exfoliant I was using then is from St. Ives. I still use it till date. It contains ceramide and it is very good. It will not dry out your skin. It does not have it does not contain essential oils. I'm not asking you to use St. Ives, I'm just giving you this as an example. So if you want to purchase physical exfoliants in pregnancy, please go through the ingredients, and you might really want to avoid the ones containing essential oils, because a lot of debate are all around about essential oils can be harmful to the fetus in your womb. So for washing your skin, I'll suggest very moisturizing washes as well, like Dove. I love Dove body washes a lot. I love them a lot. If there's another word for love, because they are the truth when it comes to moisturizing. There can be other products that are really moisturizing body washes, but I love Dove. You can also try Olay. Yeah, Olay is a very good brand. Their body washes are also awesome. And then St. Ives, they have new range of body washes this day. For your face, you need something, you don't need ash face washes, and there are lots of brands you can explore, like CeraVe, like Aveeno, like Cetaphil, like E45 also have a range of face washes, and those brands I mentioned are gentle enough to use in pregnancy. I mean their face washes. Let us talk about moisturizers. In fact, it is the most important thing for you to do in your skincare in pregnancy. You really need it, especially if you want to avoid stretch marks. So let us start with face moisturizer. You don't need drama in moisturizers actually, as long as they are not moisturizers that are going to clog your pores or containing actives, containing whitening agents. Just go for simple moisturizers. I have some here. I use this topic cream is actually very good. This one, Simple Moisturizer, is also very good, and this one from E45 is also very good. Let us go to body moisturizers. That is where the real work is. In pregnancy, you need moisturizers that are rich, that are going to deeply moisturize your skin. If not, you're going to have a lot of stretch marks in pregnancy. And for that, I recommend Dove lotions. Dove lotions are really, really moisturizing. I recommend CeraVe lotion or the cream. Either ways, they are very, very moisturizing. And I also recommend topic cream. They have body moisturizers. They're not going to lighten you, they're not going to whiten you, they're going to moisturize your skin, which is something you really need. I also recommend E45 lotion. That is what I use, my whole family use. I love E45 lotion. It is very good. Here's what it looks like. And also Aveeno is very, very lovely, to be honest. That's just what I can say. I used it when I was pregnant, and the richness, the thickness is really something to go for if you can afford it, because at times it can be pricey, especially in certain parts of the world. I use this during winter. To be honest, even now I use it during winter right now, because it is very, very thick and it will moisturize your skin during winter. E45 don't do much for me during winter, but Aveeno always cut it. So if you're pregnant and you can afford it, Aveeno is really, really a good choice for you to use in pregnancy. It is going to give you all of that moisture that you need. So let us talk about another important part of skincare in pregnancy: oils. You need oil in pregnancy. You need oil. You need lots of oil in pregnancy. And the oil I used in pregnancy was this Palmer's Choice Cocoa Butter formula for stretch mark. To be honest, when I started using it, I didn't have stretch mark in pregnancy. I mean, on my stomach. I wish I could take a picture of my stomach and show you guys, but that is the truth. I didn't have stretch mark on my stomach in pregnancy, and that was because when I finished moisturizing, I oiled my stomach right away. And you will notice that if you're pregnant, your stomach gets dry very easily. So if you notice that your stomach is getting dry, how are you going to know that your stomach is getting dry? It is going to be itchy. So when your stomach is itching you in pregnancy, please and please resist the urge to scratch it. The more you scratch your skin, your stomach when you're pregnant, or your breast, those two areas can be really itchy in pregnancy. The more you scratch it, the more stretch marks you will have. And the tricky part is the stretch marks are not going to come just right away. It might be months after that, or weeks before you start seeing the stretch marks. So if your skin is itching you and you're at home, you're indoors, or you're somewhere that you can just enter the toilet and quickly rub some oil, rub oil onto your stomach, onto your breast, avoid scratching it. That is what causes stretch mark. Your skin is stretching, so your skin is going to get irritated a lot, which is going to cause you itching. So instead of you itching it, give it moisture. That is what I was doing then. The moment I start feeling this itchy sensation, I grab my moisturizer, I grab the oil, and I massage it into my stomach and my breast, and that was it for me. I'll be showing you oils you can use in pregnancy. Please, I'm not saying that if you use oil, you're not going to use moisturizer. No, you're going to use the two together. You're going to use the two together. If you use moisturizer, you still need to use oil. If you use oil, you need to use moisturizer. Oil is not going to do what moisturizer will do for your skin, and moisturizer is not going to do what oil will do for your skin. Please and please, they are not the same thing. So I will be showing you the oils. This is the one I used in pregnancy, and I still use it till now, to be very honest, and this is why I have it. This is what it looks like without the pack. This is how it looks like. This oil is the truth in pregnancy, I kid you not. And another one I'll be showing you is this one. It's also from Palmer. You can see this one is empty. I finished using it already, but I recommended it to some people in pregnancy and it really did their skin well. So you might want to take a look again, and it's not that expensive, I believe. And then this, I have the small size Johnson baby oil. I'm sure all of us know it. Johnson baby oil, it is good for you in pregnancy. It is. And the last oil here is Aveeno. It is very good. I'm using it currently. I use it after my moisturizer. It is very thick. The only difference between this and Palmer's Choice, the first one I showed you, is that Aveeno can be on the heavy side. It can be heavy on your skin. So if you stay in the warmer region, Palmer's Choice is really your choice. Yeah, Palmer's Choice is really your choice. So if you stay in the warmer region, Palmer's Choice can just be the one you will go for, because it means your skin will be eating up more than normal. But if you stay in the colder regions, like there's winter, more cold and all of that, just go for Aveeno. Aveeno is very good. If you stay in the colder region, Aveeno can be your choice. Am I saying that if you stay in the warmer region, you cannot use Aveeno? Of course, you can use it. I'm just telling you the difference between the two. Even I stay in the colder region currently, and I don't use Aveeno every day because it can be heavy on the skin. So if the weather is warm, I don't use Aveeno. If the weather is cold, that is when I really use it. So the difference is Aveeno is kind of heavy, Palmer's Choice is kind of light, and Johnson Baby's oil is also lightweight, so you can use it if you are in the colder region. The second Palmer's Choice oil I showed to you is also lightweight, so you can use those ones. Please and please moisturize your lips. Moisturize your lips when you're pregnant. I see some pregnant women with chapped lips. No, please don't do that. Moisturize your lips. Get lip balm. For me, I've been using Vaseline lip balm for years. I think since 2020, if I'm not wrong, and I use this currently, and it is very, very lovely for me. It makes your lips so soft. So if you're pregnant, rub something on it in the morning, in the night, before you go to bed. Rub. It is very important. And I didn't mention it earlier, but it's important that you shower, you have your bath at least 2 times a day. Wash yourself at least 2 times a day if you're pregnant. If you can't even do it 2 times a day, at least once a day. Some pregnant women can go 1 week without washing themselves. Come on, please. Wash yourself at least once a day if you're pregnant. You need to wash your armpits, wash everywhere if you're pregnant. So that is all I'm going to be talking about in today's video: how to avoid stretch marks in pregnancy and how to make your skin glow in pregnancy. If you have any question, drop it in the comment section. I'm going to respond. And if you still feel confused, please contact a professional. So we've come to the end of today's video. Thank you very much for staying with me till the end. I really appreciate you. Please like this video, share it to your friends, share it to your enemies. Yeah, share it to your friends, share it to your enemies, share it to your family, share it to every pregnant woman around you. They really need this, please, because there's a lot of judgment. Oh, when you get pregnant, you're going to start looking like an old woman. You really don't need to look like that when you're pregnant. There is information now, so please share the information around, and please subscribe to the channel. Please subscribe to the channel. Thank you very much. I really appreciate you. Till my next video, stay glowing.